For Jagga.
Thank you, Deputy Speaker. Well, in May, our government asked Australians to give them to give us the opportunity to deliver a better future for all of them, and they were clear when they voted our party in that they were looking to our government to fix a number of outstanding challenges that communities like mine are facing. And I am very clear that some of the biggest challenges that my community and I think communities around the country are facing is very much in our health system. When we look at the impact of Medicare having been underinvested in, having been undermined for almost a decade, and also in our aged care system, where for too long the care of older Australians just has not been what it should be. Older Australians should absolutely have dignity in their lives, and as I said, for too long, that has not been the experience of people in the aged care system. And I've certainly heard from so many people in my community about their concerns about what's happening in aged care. I've had people come to me and say that they weren't sure if they didn't go in every day whether their loved one would be fed. I've had people come to me and say how unsure they were whether their loved one in aged care was getting the appropriate medical care. The GP only came once a week, there wasn't a nurse there, it was unclear what sort of support was being offered. And of course, having a loved one in aged care is difficult enough without having these extra worries on your mind. So our government has absolutely made fixing aged care a priority of the work we are doing, because we know that all Australians should have confidence that in their old age they will be able to live with dignity. That is a fundamental right for them. So we're determined to reverse the neglect of the previous government, and we're committed to putting security, dignity, quality and humanity back into aged care. Aged care will remain a top priority for our government. I'm particularly proud to be part of a government that's committed to putting nurses back into the aged care system. As I said, it's a concern a number of constituents have brought to me that they're just not sure what medical care is there. And then they've come in the morning and asked, well, why wasn't this addressed overnight? And the reality was there was just no one there to address it. So having qualified nurses in our aged care homes 24/7 is going to be a game changer. It's not easy. Of course, it will take us some time to get there, to make sure that this reform is put in place in a way that is sustainable, that is implementable, but I'm absolutely confident that we are doing the work we need to do to make sure that older Australians in aged care are getting that level, that standard of care that they should. The Implementing Care Reform Bill, which passed Parliament in October, as well as having that requirement to have a registered nurse on site from 1 July 2023, it means that those people will get that immediate clinical attention when they need it, and fewer unnecessary trips to hospital as well, which of course, again, hospitals in my area are very much overstretched at the moment. So the more we can provide this care in nursing homes, in aged care homes, before people need to go to hospital, the better that will be for all of us. Of course, the new aged care classification funding model started from the 1st of October this year, and this new model will provide more funding for residents in residential care, with an uplift of nearly 13% more funding than the previous model, as well as more equitable care funding to providers that better matches the needs of residents and the levels of care they receive. And so this means carers will have more time to care for older Australians, an average of 35 additional minutes per day compared to current levels. Again, one of the things I hear constantly in my community is that people are very much concerned that the care, while they respect the aged care workers who are working so hard to provide care to their loved ones, they just don't have the time. So this will help with that problem. And of course, we are also working to get aged care workers the pay rise that they so richly deserve and need. Deputy Speaker, outside of aged care, our government is also aware of cost of living pressures facing older Australians. Earlier this month, we increased the thresholds for the Commonwealth Seniors Health Card, and this is one way we are supporting older Australians. The annual income thresholds will increase to $90,000 for singles, up from the current limit of $50,761, and $144,000 for couples, up from the current limit of $92,416. And this delivers on an election commitment we took to older Australians, ensuring that more people, and I know people in my community are very pleased about this, will qualify for the Commonwealth Seniors Health Card. And that will make a real difference. Alongside this, I'm very proud that our government is making medicines cheaper from the start of 2023. And people in my community will absolutely benefit from that at this time when, again, we know cost of living pressures are a real thing. To have that safety net in place, to know that your medicines will be cheaper, will be a big thing for people in my community, particularly, again, for older people in my community who I know have been struggling with the cost of medicines. Deputy Speaker, one of the biggest issues that my constituents are bringing to me at the moment is an issue around GPs in the community. And certainly in the past few months, I have had a number of people come to me and say, the last bulk billing doctor in the area just shut down. There's nowhere we can go anymore to get bulk billing services. And this is a real concern, obviously. Our system is built on Medicare being there for people when they need it, on access to a GP being affordable. And it's a system our government inherited because the previous government neglected Medicare. They failed to do the work they should have done to make sure that this absolute plank of our health system, the bit that's holding it all together, was as strong as it should be. And so we're now in this situation where in communities like mine, people are starting to wonder, will I be able to get in to see a GP? If I do get in to see the GP, will I be able to afford to see the GP? This is not the health system that our country wants or deserves. And so I am very pleased that the Health Minister recognises the seriousness of this situation, that our government is doing everything we can to start working on this problem that we've inherited from a decade of neglect, from a decade of a government that just didn't value Medicare and hasn't done the work to make sure our GPs were set up in our communities. So we've started on the important work with the appointment of our Strengthening Medicare Task Force, which is a group of experts and other representatives who will be looking at these issues around improving patient access to GPs, access to nursing and allied health services, affordability issues, and the management of complex cases. So this is really critical to our health system locally and across the country. We're investing $750 million to implement the highest priority reforms that are recommended by the task force. So we really do want people to see improvements in our health system as soon as those recommendations can be made and can be implemented. And of course, in my local community, I am very pleased that we have a commitment to have a Medicare urgent care clinic established. I know our local hospital, the Austin Hospital, does wonderful work, but they, like hospitals around this country, are overstretched. When I talk to them, when I talk to the nurses who work there, they just keep raising with me our ED is just absolutely always at a level of busyness we've never seen before. And they know that if we are able to take some of the pressure off those EDs, if we are able to get our GP system functioning so that that can do the work, so that people know that they can go to a GP, and including this Medicare clinic that we will establish for some of those issues that they're currently going to the emergency department for, that will absolutely make a difference to those people. So, Deputy Speaker, I really want to highlight how critical this issue of fixing our health system is to my community and to communities around the country. I know that GPs are such an important part of our health system, and our government knows this, and that is why our government is investing in Medicare. We are doing everything we can to work out what's gone wrong over the past decade, to look at the impacts of the previous government freezing the Medicare rebate for 6 years, ripping billions from healthcare and, of course, seeing gap fees skyrocket. That is not the country we should live in. Healthcare in this country must be affordable, it must be accessible for all, and making sure we have a strong Medicare system and strong local GPs is a big part of that.